Okay, so today we are going to continue with the last thing, that was pharmacology, how we can administrate the drugs. So we have seen the intravenous, but in textbook we have some few extra points, so we'll cover that as well today. Okay. So intravenously, it is injected to the superficial vein intravenously, okay? And it's directly reach the circulation and immediately available for action. So drugs can be given in IV. So what kind of drugs? And in this, what we do is even for the immediate action, we are giving those drugs, and even for those drugs that we want for the slow absorption. So in both, we can use intravenous. Okay. So first is the bolus, where an initial large dose is given. Okay, the drug is dissolved in a suitable amount of a vehicle and injected slowly. Then the second come is how if you want to give for next 15 minutes. Okay, so there are some that you just have to give a one shot, that also you can give intravenously if you have to induce a drug within 15 minutes. Okay, you just don't have to give in within a minute or within a second, but you have to give that dose slowly for 15 to 20 minutes, that also you can do. And there are some other that you have to infuse for 24 hours. Okay, so that we say slow infusion. When the example is when the constant plasma concentration are required. Okay, majorly in the labor, or when we are putting a patient on the saline with in using some drugs for 24 hours or something. So those are the things that takes hours and hours. Okay, so that for those drugs we are using intravenously. The advantage is most useful for the route in emergency, as a drug is immediately available for action, provide predictable blood concentration with the 100% of viability. 100% of viability is the drug is going to be used 100%. There is no first pass, second pass, or there is no gastric irritation. So that's when we say 100% of bioavailability. The large amount also you can give. There is one more advantage. Irritants, irritants can be given by this route as they get quickly diluted into the blood. Rapid dose is adjusted are possible. So as I told you, okay, we can adjust the dosage speed. Okay, that is one advantage. Any irritants that you have to give, that you can give because it will get directly dissolved. 100% of bioavailability can be acquired in the emergency procedure, as well as for the time being you can use this. So we'll see the disadvantage now. Once you have given it, you cannot withdraw it. Okay, once it's in vein, you cannot undo it. So one has to be very careful. Sometimes what happens while puncturing it, or sometimes the drugs are so concentrated, they end up giving the vein irritated. Okay, the vein get irritated, or sometimes what happens, the veins get swollen. Okay, when we are giving large amount of any drug, the vein gets swollen, so that also a disadvantage. The other is only aqueous solution can be given IV, but not the suspension, oily solution, and depot preparation. So, what do you mean by this aqueous? When the soluble, only the soluble particles can be given to this, not the oily solution or not the preparation of the food, like the particles we cannot put. We have to give those drugs that get soluble in water or in that blood or anything. Okay, you cannot give something that does not get dissolved. The other is intraperitoneal. Peritoneum offers a large surface area for absorption. Mainly it is given to the infant. Okay, peritoneal dialysis. Intrathecal is, as we have seen, this is used in the CNS, subarachnoid space of our brain. Any drugs that we have to input over there, any corticosteroids, any major steroids we have to give, any antibiotics we have to give. In those cases, we are giving intrathecal. Okay, so what happens in this? The drug can be injected into the subarachnoid space for action of CNS, like spinal anesthesia, some antibiotics, or corticosteroids. Drugs are also given extra durally is morphine can be used epidurally to produce analgesia. Okay, when any anesthesia we are giving in a spine, so these are the area where we give. Okay, this one is in the spine area that we give just between in our spinal cord, and the other is intrathecally we give. Now the other, as we discussed last time, intra-articular. Drugs are injected directly into the joint. Now what happens? What kind of drugs we would be infusing directly to the joint, and in what cases? Mostly in OA. Sometimes what happen? We have to infuse the synovial fluid, or sometimes we have some people nowadays they induce a plasma treatment if someone is aware about that. So what they do in OA, when there is a tendon rub is there, when tendon is damaged, so what happened, they give plasma. So they take the blood of that patient, then they will remove the plasma of them, and then they will infuse intraarticularly direct to the joint or direct to the place where they have a tendon rub or something. They induce their plasma. So mostly intraarticularly they give that.
Madam, this process is called the PRP.
Yes, yes, PRP.
Okay, thank you.
So do they give over there as well? Majorly it's given to the sports people or the geriatric, I think so. Nowadays, since 5 years or 6 years, it's been given. Is it already there? Like people use those therapies as well, like the normal geriatric patients. I'm asking you, means, in Bangladesh, do they use this? Like,
Please repeat, madam, please.
I'm asking, do they use this? Well, have you seen anyone or any case regarding this?
India articular, yes, ma'am.
Okay, okay, nice, nice, nice. Now the other is intra-arterial. Here what happened, the drug is injected directly into the arteries. It is used only for the treatment of any vascular disease, local malignancy, or diagnostic purpose. Mostly for diagnostic purpose we are using this. And the other is to know if we have any vascular disease or not. Okay, so that only then we are using any drug for the vascular purpose. Intramedullary is to take out the bone marrow or injection into a bone marrow. They're very rarely used. Now the other is how you will distribute the drug is inhalation. Okay, the other route that we are going to take is inhalation. There are some, I think so, majorly for the asthma patient, we use that. Any congestion we have on the nasal area, we use those things, and we to get the instant recovery from those things, this is very normally used, salbutamol in asthma patients. So volatile liquid and gas are given by inhalation. General anesthesia is and in addition drugs can be administered as solid particle. Solution can be atomized and the fine droplets are inhaled aerosol, salbutamol. Salbutamol, so what they give it droplets or something and then you inhale it. So that you can give. So what it does, it slow down the cilia exudation. What happened, the cilia get very dry and hyperactive. Okay, so that really gives thing. So when salbutamol is given to those patient, that really gives a recovery. So advantages, the absorption is very quick in this. Almost in instantaneous absorption of the drug is achieved because of the large surface area of the lung. In pulmonary disease, it's serve almost as local route as a drug in delivering at a desired site, making it more effective and less harmful. First pass metabolism is avoided in this. Any route other than the orally, I think so, majorly it is avoided. Mostly in rectal area, we'll see there we are seeing the first pass metabolism. Okay. Higher blood levels of the volatile anesthetics can be conventionally controlled as their absorption and excretion to the lungs are governed by the law of gas. The disadvantage here is the irritant gas may enhance the pulmonary secretion that should be avoided. It's like different patient having different reaction to other drugs. So there is some kind of side effect as well coming along with it. Drug is important route to entry the certain drug of abuse. Now transdermal, this has been covered, will take transmucosal. Transmucosal, here we have three. This also has been done, but I'll just repeat that. Transmucosal, there are three. First is sublingual, that we put just below our tongue. Okay, nasal and the rectal. Okay, sublingual is, as I gave you the example for BP, that is something we use. Nasal drugs can be administered to the through the nasal route, either for systemic absorption or the local effect. Here, which is given is oxytocin spray is useful the systemic absorption, local decongestion, nasal drops they will give, some allergy. Those are the things we give. So here, majorly what happen in those patients where they're having very acute or chronic allergies, na, so we give those nasal things. They even have, trachea is affected or nasal is affected. So in those areas, we give this. So majorly, it is for the decongestant and for the allergies and for the asthma. Now third comes is rectal. In this what happened, why we are giving rectal is for the those patients who are paralyzed. Some are geriatric or who cannot take it through their mouth. Okay. What are the benefits for from giving to the rectal? As what happened, because there is a very high blood supply to the rectal, so the drug administration is done very quickly and very easily. Okay, not quickly exactly, but very easily. And there are two different areas if we have to put through the metabolism through the liver, so we have to go with the different area of the rectum, so that I'll explain you. So, as rectum has a rich blood supply and drugs can cross the rectal mucosa to be absorbed for some systemic effect, drug absorbed from the upper part of the rectum are carried by the superior hemorrhoid vein and portal circulation. So, when it comes to the portal circulation, so it will, of course, will go to the undergo the first metabolism, first pass metabolism, because there is a portal circulation that is for the liver. Okay, while that absorbed from the lower part of the rectum, it carried by the middle and inferior hemorrhoid vein. So there is no part liver is going to play in this. So first pass metabolism is avoided in this. Now what happened whenever someone has to give some irritants drug, they use this route. Okay. The advantage is gastric irritation is avoided, can be administered by unskilled person, useful in geriatric patient and other. with vomiting and those unable to swallow. Now, the disadvantage is sometimes the irritation of the rectum can occur. Absorption may be irregular and unpredictable. You cannot predict to what level it has come or is it moving because it takes few hours to show the reaction. Drugs like indomethanes, cropamazine, diazepam, those are even enema. I think so. That is very normal that we give to the patient who have indigestion or those kind of thing. It is administration of the drug in a liquid form into the rectum. Enema may be evacuant enema in order to empty the bowel. About 600 ml of soap water is administered per rectally. Water distended and thus stimulate the rectum with soapy lubricants. Enema is given prior to surgeries, obstetric procedure, or radiological examination of a gut. Even before the pregnancy, they give that before the delivery, sorry, before the delivery they give, before the surgery, or when they have to examine the gut. Those are the reasons we give them. Retention of enema. The drug is administered with about 100 ml of fluid and is retained in the rectum for the local action. Okay. So other is topical. Topical means we are rubbing those drugs on the skin and expecting that to get absorbed and give the action. Okay, that is topical. Drugs may be applied on the skin for the local action. Any ointment we are giving, any cream we are giving, like we are using Move or any relief spray we are using for pain relief, for localized pain relief. Some kind of infection we have, so even antibiotics we have in the liquid. So those are the things. Any infection, some are having infection on the nails mainly. For them, we have
Sound
on.
is very slow, madam.
Voice is slow.
Yes,
Okay, okay. Can you hear me now?
yes.
Ha. So topically, as I'm saying, कि those drugs that we are going to rub on our skin or on the area that is needed. Okay. So in those, we are going to get through the gel, ointment, some powder, paste or something that we are going to apply directly and going to have the reaction on that area. Okay. So mostly in the infection region, when there is a burn, also we put some kind of drug on it. Then nail infection, if we have any pain or spasm of the muscle, even in that we use some kind of diclofenac ointment. So those are the drugs normally that we use topically. Drugs may also be applied on the mucosal membrane as in the eye, ears and nose as ointment, drop and spray. Drugs can be administered as suppository for rectum, boggy for urethra, and pessary and douche for vagina. These are the area we can spray some normal drugs and expect to get absorbed. Pessaries of oval shaped tablet to be placed in the vagina to provide the high local concentration of the drug at the site, antifungal. Mostly when they are having any infection, as I told you, so you put a drug on those area and let that absorbed over there. So you put a tablet or you break a capsule and put over there, and it get absorbed through the track of it. Now there are spatial drug delivery system. So these are the things. If we are targeting certain kind of drug and we are going to get a delivery of the drugs in different places, so just to how the absorption of the drug is happening, what kind of jet spray we are going to use, those are the things are involved in this. In order to improve the drug delivery, to prolong the duration of action, thereby improve the patient compliances, spatial drug delivery systems are being tried. Drug targeting exam, to deliver a drug at a site where it is required to act is also being aimed at, especially at anti-cancer drug. Some such system of occurrence, progesterone, subdermal adhesive unit, pro-drugs, osmotic pumps, and computerized pumps are the method. So we'll go in detail with this pro-drug, osmotic pumps, and computerized pump that we are giving. The first is occasionate, is a system of electric unit that contain the drug into the reservoir, which slowly release the drug through the membrane by diffusion. By the if you have to give a drug for longer time. Okay, one was the intravenously how we were going to do. So sometimes what happens, there are some instrument that we have and they just inject it in the body, in the membrane, and it stays there for days or hours, and then it slowly get dissolved in the blood. Okay. The other is progesterone inserted into the uterus where it delivers the progesterone constantly over 1 year. Okay, so you just inject that drug into the uterus, and for over a year, that delivery of the progesterone in certain speed is been given to them. So for giving any kind of drug for longer period of time, or to decide that how much time you have to give this drug at what place, like particular place you have to give. So this kind of different instrument and different placement of the drug has been used. The other is prodrug. So what happened that we are putting an inactive drug to some part of our body, and then it get activated or metabolized as the derivative of the body. Okay, so in this, what happened is an inactive form of a drug which gets metabolized to the active derivatives in the body. A pro drug may overcome some of the disadvantage of the conventional form of the drug administration. The major example is dopamine. So in this, what we do is dopamine is not been released, or it goes, it doesn't get activated. So we give a pro drug. What will it will do? The BBB, the gate of the CNS, it does not cross. The dopamine cannot cross. In Parkinson, what happened? Dopamine cannot cross this gate. So now levodopa will go there and take the dopamine and cross the gate, and then it will get active. So this product is not going to do anything. It's just going to help the content to work, or if he's not able to do his work, this product are just going to go and help them. Okay, so dopamine does not cross the BBB. Levodopa, a product, cross the BBB and then convert to the dopamine into the CNS. Prodrug may also be used to have longer duration of action, ampicillin acting. The other is osmotic pump. These are the small tablet shaped unit consisting of the drugs and osmotic substance placed into two chamber. The osmotic layer swirls and push the drug slowly out of the small hole iron propozoin available in this form. So in this, what we do, we just put that drug into our body, and then when the osmotic, and then what happens if one area is not going to have that much of liquid or that much of substance, when they have it, they will just push that drug into that area. So how long you need it, for 6 hours or 7 hours or for a day, so those kind of time is been put in that, or the that amount of liquid is put into, or it is soluble in that, and that's how it goes. When it comes to computerized pump, these are the programmed one. They have already decided, and at that time, at certain time and with a certain rate of speed, these drugs are administered. Okay, these all are computerized. So these are programmed to release drug at a definite rate, either continuously as in case of insulin, or intermediately in pulses, or in case of growth hormones. The other are monoclonal antibodies against the tumor specific antigen are used to deliver anti-cancer. So these are the example of computerized. First is monoclonal antibodies. What they do, they will work against specific kind of tumor, okay, and give the antigen and use to deliver anti-cancer drug to the specific tumor cell. The other is liposome or phospholipids suspended in the aqueous vehicle to form minute vesicle. Drugs encapsulated in liposomes are taken by mainly by the reticuloendothelial cell of the liver, and are also concentrated by the malignant tumor. Thus, site-specific delivery of the drug may be possible with the help of liposome. So just to deliver certain kind of drug to the certain kind of site, these are the things. We can use it computerized, we can use it as osmotic, we can use it as a pro drug, we can use for to get the normal function. So these are the routes that we are going to administrate, that we can or someone can administrate the drugs. Is this clear?
Yes, ma'am.
This is the first chapter, okay? So tomorrow I'll take this pharmacokinetics, okay? These are the basic definition, when what are the absorptions are happening or what kind of absorption happen. Okay, what are
Madam,
the
excuse me, madam. We have need a help from you that after completing the class or the chapter, please
hmm.
give us some question
Okay, okay.
which we must be attained.
Okay, okay. So for pathology, I'll say by tomorrow I'll give you those
Uh,
questions.
please,
Okay.
please, madam. Please, madam.
Okay, not an issue, not an issue. Tomorrow
Okay,
you'll get it. Tomorrow
okay,
morning.
okay, madam. Okay.
Okay.
Thank you.
Done for
And
today. Yes.
all other subject which are decorated by you, madam.
Yes,
Please
yes, yes, yes. But
attach.
today, yes, yes. Last time we just completed pathology, na? One chapter.
Yes,
So I'll just,
yes, madam.
so I'll make that. And once we're completed by this chapter, I'll give you. Okay,
Okay,
what
madam.
kind
Okay,
of
thank you.
question can be asked, 1 mark or 5 marks? Any short
Right,
note,
right, right.
I'll give you that.
Yes, yes, madam.
Okay.
Yes, madam. Yes, yes, yes,
Okay.
madam.
Hmm.
Thank you.
Okay. So tomorrow we'll continue with this.
Thank
In
you.
this, bioavailability is important, so I'll take it in proper way. Okay.
Okay.
Take care.